surgery, and of course if he has an insurance, what is the insurance policy number, and so on. Today, everything is possible. All this have been indigenously developed by the in-house technical team at the Apollo Hospitals, Hyderabad. A mobile handwritten prescription can automatically be translated beautifully into a regular Word document. You can see ECGs being transmitted. You can see vitals being transmitted. Insurance claims can be processed from mobile phone. Last year, the Chennai Corporation started sending SMS messages to women who had just delivered as reminder service so that their babies will come for immunization. And recent studies have indicated that the compliance and adherence rate has increased 10 times. The Kerala government has done enormous work on SMS and again, doctor on call on your mobile phone. Today, India, I'm sure Mr. Bedi will confirm this, from the era of e-governance, they are slowly moving into the era of M-governance. No less a body than the North American Radiological Society, the most respected society of radiologists in the world, have officially confirmed that the quality of images on a phone is sufficient for doctors to make accurate diagnosis of appendicitis. From a medical legal point of view, in a court of law, this will stand, and today I can make a diagnosis. Ladies and gentlemen, this is what is going to happen, not in the future, but in your lifetime. Maybe 2 years from now when we have a conference like this, I would be able to provide you with data and tell you that you cough into a phone and you will be able to get a diagnosis. After all, it's only a question of acoustic vocalization analysis software. Depending on the timbre, the pitch, the quality, etc., etc., the mobile phone will be able to tell you whether this is whooping cough, pneumonia, or even a bronchogenic carcinoma. So this is what is going to happen. To tell you that wireless medicine is not as remote as you think, 6 months ago, there's an advertisement for an MD course in wireless medicine. A doctor, an MD, can now specialize in wireless medicine. Scripps Institute has just started this at California, and I understand there already are more than 10 applicants to do a 3-year MD course on wireless medicine. I had the opportunity of seeing this just a few days ago at MIT, and blindness. Every fourth human on the world lives in India with blindness. Which blindness need not necessarily mean totally blind, but a refractive error so that your visual acuity is diminished. Unfortunately, we just don't have, we will never ever have enough number of optometrists to check your refractive error. But just look at this. All you require is a software program which has been developed by Indians at MIT. There are 2 different lines here. You can make out the red line here, the green line here. All you have to do is to manipulate the buttons on your mobile phone and bring the red and the green together so that they are superimposed one on top of the other. You don't require a PhD to do this. Anybody will be able to do this. And based on the number of manipulations which you had to do, based on which button you had to press how many times, the computer will calculate your error and will come back on the display saying minus 2.25 spherical, plus 1.75 cylindrical, axial, astigmatism, etc., etc. You get a prescription. Now, if we had this facility, which we are planning to get, literally hundreds of thousands of people with a refractive error will be able to get some benefit out of it. Today, there are lots of articles. Every now and then the news is flooded with information that it is dangerous to use a mobile phone. Do we get brain tumors if we use a mobile phone, and so on. At the other extreme, maybe this is a digitally manipulated photograph. Maybe it is not true. But you just don't know. Maybe it will become true one day. You would be able to even put, especially for doctors, not for all mobile phones, for licensed people, it could theoretically be possible to have a source of radiation inside the mobile phone. And if you think you've got a fracture of your metatarsal, all you do is to focus your mobile phone on top, and you will be able to find out whether there is a fracture or not. Mobile phone being used as an X-ray equipment. So, what is really going to happen? What is really going to happen is the fact that we are going to talk about wellness. We are not going to talk about illness. It doesn't make sense to do 100,000 cardiac surgeries because of atherosclerosis to the coronary artery, which in 99% of cases could have been prevented. It is not purely genetic, it is environmental. If only you had reduced taking all those fatty foods, certainly it would have helped. So insurance companies, at the end of the day, if anything is to progress, it's vitamin M, vitamin M, vitamin M. It has to be self-sustaining, revenue generating. Ever since the Phoenicians discovered money, this is the only incentive. All this other talk about saving lives, etc., we all know it is nonsense. So what is going to happen? Insurance companies, because they don't want to dole out crores of rupees for reimbursement of bypass surgery, it is in their interest to know that your cholesterol is kept well within grounds. So the next time you are going to get out of your car and go into Kentucky Fried Chicken or McDonald's or somewhere else through GPS, GPRS, Hyderabad buses have it, Chennai buses have it, the insurance company will precisely know that Dr. Ganapathy, age so-and-so, for insurance number so-and-so, he has just got out of his car, he is looking at that Kentucky Fried Chicken, and you will get a message. You will get a message, hey look, your cholesterol is 285, mine is not, but just, your cholesterol is 285, are you sure you want to take that pizza? And it will also tell you that 50 yards ahead is a green salad counter, why don't you take salads? And probably your potassium level will come down. You remember that 6 months ago you had hypokalemia, etc., 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 etc. They are not doing this because they are concerned in your health. They are doing this because they don't want you to have a bypass surgery. Now, if you are an asthmatic, this is what is going to happen. There will be sensors everywhere. So the car will tell you that you are driving at 70 kilometers per hour in the highway. In exactly 8 minutes, you will reach a place where the pollen content or the environmental pollution, whatever you call it, is so high that you are likely to go into status asthmaticus. So please take a diversion, go through some other place. All this on your mobile phone. I got these slides from the Institute of the Future, Palo Alto, California, where they have already proved this. They have done this. This is not just hypothetical. It has not come to Hyderabad and Chennai, but it's a question of time before it comes to Hyderabad and Chennai. So ladies and gentlemen, this is the world we are going to live in. To always deliver more than promised, today I don't think we should be talking of achieving world class. The world should be talking of achieving India class. We have the doyens of medical care and the czars of health technology. Unfortunately, the use of ICT in healthcare is still not really permeated into the brains of the CEOs of the hospitals or the IT departments. Healthcare industry is one industry which is recession proof. It is one industry which will survive so long as mankind exists. From antenatal to post-death, even after you are dead and gone, your stem cells can still be used. So this is one industry which will ever survive. And my plea to you is, as I said, belonging to the BC era, it's so thrilling for me to see this exhibition, this conference, and compare it with what it was 30 years ago when some of us started our medical career. And I think we are on the brink of creating a revolution. And I dream of the day when every white man will be standing outside the Indian embassy in Washington waiting to get a green card.